Hi, Dr. Sasse here from Sasse Surgical with a little bit more word about revisional weight loss surgery. One of the things that's really confusing in the peer-reviewed medical literature is the use of terminology and acronyms. And this is a little maddening even for people within the field, but I know if you're not totally ensconced within the world of metabolic and bariatric surgery, it's very confusing to look at the literature and how people term different procedures. So I'm just going to mention a few things here that help clarify hopefully what your options are and what you may be reading about. I'm going to focus specifically on duodenal switch, and I use that term to describe an umbrella of procedures that involve a connection being made from the duodenum. That's the part right after the stomach. That's the first part of the intestine. That occurs right after the stomach in what's called the pylorus at the end of the stomach. And that's connecting to the ileum, which is kind of the last part of the small intestine. And that duodenal ileostomy, that's a duodenal to ileum connection, has really proven to be highly successful. It seems to have something to do with the communication of the hormones and enzymes from the upper stomach and duodenum area right into that ileum, which is very rich in receptors for all of those important hormones and chemicals. And it produces a profound signaling response within the body that says, hey, we have plenty of nutrients here. It leads to less fat storage, less hunger, less nutrient absorption, and profound long-term weight loss and reversal of diabetes. So it's a very helpful mechanism that we tap into with the procedures that involve duodenal ileostomy or duodenal switch. The maddening thing is that people have called it different things, and so there are versions of it, which it's not important to know the exact reasons why they're different, but they're not that different, that involve something called biliopancreatic diversion, or BPD, and then the term duodenal switch. More or less, these are accomplishing the same hormonal effects. More recently, we see the use of terms like SADY, S-A-D-Y, which refers to single anastomosis duodenal ileostomy. Boy, there's a mouthful. That just means that instead of the two connections that used to be required to do that reconstruction after the duodenal switch, this one involves only one connection, hence the single anastomosis is the surgical word for connection. And so that has a few other names too, because people chose their own language for it, and there have been other acronyms chosen such as SIPS and Sasse. You'd think I would have liked that one, but it was S-A-S-I. All of those fall under the umbrella of duodenal switch, and all of the research to date has indicated that both single and double anastomosis duodenal switch appear to work about the same. They seem to create around the same outstanding hormonal response that creates the excellent long-term weight loss results and the excellent diabetes reversal results. So regardless of that alphabet soup nomenclature, just know that duodenal switch has been around a long time. It continues to be refined. I would argue that it's become a lot gentler, safer, simpler, and it's a very effective revision option for many people. At our center, it has been the go-to procedure for revision after a failed sleeve gastrectomy, or a sleeve gastrectomy that did not produce the best results, or one that allowed weight regain or diabetes to recur, and I won't use the word failed. And that's been an excellent answer, and that usually works very well with a minimally invasive, safe operation that usually produces outstanding long-term results. So I hope that's helped a little bit as you're looking at this alphabet soup regarding duodenal switch. But know that that umbrella term tells you that you're talking about a very effective procedure. As you're talking with your own individual surgeon, get the guy who's very experienced at revisional procedures and kind of untangle a little bit which procedure it is that he or she performs, and then go and read about that one. You can look at the specific acronym to kind of see if that jives with your own thinking. I wish you the greatest success with that. Please know that there are always excellent options out there that can almost always help you get to a better place in terms of health, longevity, and healthy weight.